Hospice is a comprehensive and personal care plan that offers comfort and support to patients and their families through a team of multidisciplinary healthcare professionals.
I like working with the VNA. I've worked with them for the last 20 years that I've been here. They've been a wonderful organization on all levels. They really show a lot of care not only for the patients but their families and the providers.
We offer opportunities to have conversations about, where they are in their disease process, how they're feeling about, being diagnosed with a terminal illness and how they feel about that emotionally, what that means for them as the patient and what they may feel as a family to be going through this together. And give them opportunities to talk about that and not just from a medical standpoint, but from an emotional and a spiritual standpoint, what that means for them to have a terminal diagnosis and to support them through that wherever they are in that process, whether they are still angry, whether they are have come to accept where they are, and make those remaining days, whatever they may be, the best that they can be.
When working with patients, every patient gets a different type of scenario, but they can always expect to get an individualized care where we're focusing on their life and what they have left versus dying and the dying process.
The biggest misconception by far amongst patients with hospice care is that it's basically hospice equals death, and that's not true whatsoever. Really, a lot of the patients do have terminal illnesses, but what the VNA hospice brings to the table is that ability to make that transition more comfortable for not only the patient, but especially the family.
I think most times what I hear the most from families and patients alike is, what is this going to look like? How long is this going to be? So it's really letting them know the process so that they can better prepare, and then that a lot of times eases their anxiety so that they can make the best of what's left in their journey.